taking vital sign or cardinal sign. Definition: the measurement of physiologic functioning, especially body temperature, blood pressure, pulse, and respiration. Purpose: serve as guide in meeting the needs of the client, aids in the planning of care for the client, and establish baseline values of the client's cardiorespiratory integrity. Temperature taking. Definition: balance between body heat production and heat loss by the body. Purpose: to determine alteration in thermoregulating system of the body and establish baseline data for subsequent evaluation. For the equipment, we are going to use auxiliary thermometer, cotton balls, and alcohol. Watch with second hand, paper, and pen. Procedure number 1. Identify client and explain procedure. Rationale: to ensure correct procedure to right patient. Explaining procedure help to reduce anxiety and fear, thus promoting cooperation. Hello sir, good morning.
Good morning.
My name is Juan Miguel Apat. What is your name?
Paul Ardoyo.
So, I will be the one who will check your body temperature. Procedure number 2. Assess the client's skin if warm to touch. Rationale: to assess signs of fever. Procedure number 3. Assess the most appropriate site to check the temperature. Rationale: to save time and to identify the correct thermometer to be used. Procedure number 4. Gather equipment needed. Rationale: to facilitate systematic assessment and measurement. Procedure number 5. Wash hand. Rationale: reduces transmission of microorganisms. Procedure number 6. Draw curtain around bed and or close door. Rationale: to maintain client's privacy and promote comfort. Procedure number 7. Assist client in supine or sitting position. Rationale: to provide easy access to axilla. Procedure number 8. Remove clothing or gown away from shoulder and arm. Rationale: to expose the axilla for correct thermometer placement. Procedure number 9. Pat the axilla if very dry. The tip is placed in the center of axilla. Rationale: to prevent incorrect reading of temperature. Procedure number 10. Insert the thermometer and leave in place for the required amount of time. Place arm across the chest, usually 2 to 3 minutes. Some digital thermometer give short beep when reading is done. Rationale: to provide enough time for recording of the temperature. Procedure number 11. Remove the thermometer and wipe with tissue away from finger towards the tip. And read the result. Rationale: to prevent cross-contamination, wipe with least contamination to area most contaminated. Procedure number 12. Inform client thermometer reading. So, okay sir, your thermometer reading is 37.1. Rationale, to promote participation in care and understanding of the status. Procedure number 13. Dispose, wipe, and use contaminated items in the receptacle. Rationale, confining contaminated article reduces the spread of microorganisms. Procedure number 14. Wash hand. Rationale, reduces transmission of microorganism. Procedure number 15. Evaluate the temperature taken. Rationale, to identify if the client has normal or abnormal body temperature. And lastly, procedure number 16. Record result and graphing sheet for documentation. Rationale, serve as baseline date for healthcare provider. Vital sign taking or cardinal sign is already done. Pulse taking. Definition: expansion of the arterial wall occurring with each ventricular contraction. Purpose: to provide clinical data regarding the heart's pumping action and the adequacy of peripheral artery blood flow. For the equipment, we are going to use watch with second hand. Procedure number 1. Identify client and explain procedure. Rationale, to ensure right procedure to right patient. To alleviate fear and anxiety, thus promoting cooperation. So, good morning, sir.
Good morning.
My name is Juan Miguel o Apat, and I will be the one who will check your pulse today. Procedure number 2. Assess the client's condition, check nature of pulse. Rationale, to serve as baseline data. Procedure number 3. Assemble equipment. Rationale, to save time and effort. Procedure number 4. Wash hand. Rationale, reduces transfer of microorganism. Procedure number 5. Have the patient rest his arm alongside with his body, with his wrist extended and the palm of the hand downward. Rationale, this position places the radial artery on the inner aspect of the patient's wrist. Procedure number 6. Have your middle three finger on the palm side of your patient's wrist. Place thumb on the back of the patient's wrist. Rationale, fingertips are sensitive to touch and will feel the pulsation of the patient's artery. Thumb should not be used because it has pulse, to avoid confusion. Procedure number 7. Apply enough force or pressure so that you can feel the pulse. Not too hard, not too light. Rationale, pressing too hard may stop the blood flow of the blood and you will not be able to feel the pulse. Too little pressure will be imperceptible. Procedure number 7. Procedure number 8. Using a watch with second hand count the number of pulse felt on the patients for 1 full minute. Rationale, enough time is necessary to detect irregularities and abnormalities. Procedure number 9. If the pulse rate is abnormal, repeat the procedure. Rationale, to determine accurately its rate, quality, and rhythm. Procedure number 10, wash hand. For infection control measures. Procedure number 10. Procedure number 11. Evaluate nature of pulse. Rationale. To identify if the client has normal or abnormal pulse in terms of rate, rhythm, and quality. And lastly, procedure number 12. Record the pulse, rhythm, and force immediately in the graphing sheet. Rationale serve as baseline date for healthcare providers. Pulse taking is already done. Respiration taking. Definition: the act of breathing which include intake of oxygen and the output of carbon dioxide. Purpose: to provide valuable information about the client's physical and emotional health. For the equipment, we are going to use watch with second hand. Procedure number 1. Identify the client and explain procedure. To ensure right procedure to right patient. To alleviate fear and anxiety, thus promoting cooperation. So, good morning, sir.
Morning.
My name is Juan Miguel o Apat, and I will be the one who will check your respiration. Procedure number 2. Assess the client's condition. Check nature of respiration. To serve as baseline data. Procedure number 3. Gather equipment needed. Rationale: to save time and effort. Procedure number 4. Wash hand. Rationale: to reduce transfer of microorganisms. Procedure number 5. Hold the client's wrist as if you are taking his or her pulse. Rationale: this way the client is not conscious, breathing is being watched. Awareness of the respiratory rate assessment will cause the clients voluntarily to alter the respiration rate pattern. Procedure number 6. Note the rise and fall of the patient's chest for each respiration. Rationale: complete cycle of respiration and expiration constitute one act of respiration. Procedure number 7. Using a watch with a second hand, count the number of respiration of the patient for 1 full minute. Rationale: sufficient time to determine the depth and the other characteristic is necessary. Procedure number 8. Wash hand. Rationale: to reduce transfer of microorganisms. Procedure number 9. Evaluate the character of respiration. Rationale: to identify if the client respiration is normal or abnormal. And lastly, procedure number 10. Record the number, character, and the depth, the desperation of respiration. Rationale: to serve as baseline data. Respiration taking is already done. Blood pressure taking. Definition: pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. The purpose of this is to determine the vascular resistance to blood flow and to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. For the equipment, we are going to use blood pressure apparatus. Sphygmomanometer, stethoscope, paper and pen. Procedure number 1. Identify and explain procedure to the client. Rationale, to ensure right procedure is done to client and gain the client's cooperation. So good evening, sir. My name is Miguel Apat and I will be the one to check your blood pressure. Procedure number 2. Assess client's physical status. Rationale, to ensure that the client's rested and identify the affected side of the client. So, sir, good evening. May I know if you have pain on your both left and right side of your body?
No.
Okay. Procedure number 3. Determine the client's baseline blood pressure. Rationale, for comparison of result during monitoring. So based on your monitoring chart, sir, your blood pressure this afternoon is 120/80. So tonight we are going to check your blood pressure again if there is an increase or decrease. Procedure number 4. Assemble the equipment. Rationale, to promote the efficiency of the health care provider. Procedure number 5. Wash hand. Rationale, to decrease the transfer of microorganism. Procedure number 6. Place client in a comfortable position, lying or sitting, and position the arm at the level of the heart. With the palm of the hand facing up. Preferably use left arm because it is near the heart. Rationale, this position places the brachial artery on the inner aspect of the elbow that at a stethoscope disc can rest on it conveniently. Having the arm above the level of the heart causes decrease in BP. Procedure number 7. Wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 2 to 5 cm or 1 inch above the antecubital space. Rationale, pressure in the cup applied directly to the artery will give the most accurate reading. Procedure number 8. Rough up around arm smoothly and snugly. Not too loose, not too high. Rationale, a smooth cuff and wrapping procedure equal pressure and give accurate reading. A cup too loosely wrapped will give inaccurate reading. Procedure number 9. estimate the systolic pressure, palpate the pulse of the brachial artery. Inflate the cuff and note the reading when brachial pulse disappear, deflate the cuff. Rationale, to prevent underestimation of the systolic pressure or overestimation of the diastolic pressure. Procedure number 10. Wait for 1 to 2 minutes before making further assessment. Rationale, to prevent false reading. Procedure number 11. Place stethoscope earpieces in your ears and close screw valve on the air pump. Rationale, sound are heard more clearly when the earpiece follow the direction of the ear canal. Procedure number 12. Palpate brachial artery, turn clockwise to close, compress bulb to inflate of cuff to 30 minutes Hg above points where palpated pulse disappear. Rationale, to get the accurate result. So we are going to add 30. So here. Procedure number 13. Release the air in the cup slowly so that the pressure goes down at the rate of 2 to 3 mm Hg per second. Procedure number 14. So rationale, if the air released too slowly from the cup, there be a congestion in the extremity causing the false reading. When it is released too fast, the sound may not heard at accurate level. Procedure number 14. Listen for a second. First, listen loud muffling sound of systolic pressure. Continue to release the air slowly. Last soft sound is systolic pressure. Rationale to get accurate result. Procedure number 15. After the final sound has disappeared, deflate cup rapidly and completely. Rationale to release the remaining air from the cup and prevent congestion in extremity. Procedure number 16. Roll the cup in place in the case. Wipe the earpieces of the stethoscope with antiseptic and back to its proper place. This method of removing dirt to prevent cross-infection of the ear. Procedure number 17. Wash hand. Rationale to prevent transfer of microorganism. Procedure number 18. Evaluate nature of blood pressure. Rationale to compare from the baseline data. And lastly, procedure number 19. Record the result taken. Rationale for monitoring purposes. So your blood pressure tonight, sir, is 120/90. Blood pressure taking is already done.